Hear, hear. Hear, hear. Hear, hear. Parkinson's Podcast. Welcome to the Hear, Hear Parkinson's Podcast, where you will hear from special guests covering the world of Parkinson's with a deep dive on the World Parkinson Congress and a look at how the WPC has helped make extraordinary progress in the Parkinson's community by creating space for people with Parkinson's to have a seat at the table.
Here. It's another new podcast episode in the Here series. And if you haven't heard the Here, short version is it's a series of podcasts leading us all towards the next Global Congress in Phoenix, Arizona, May 2026, sort of so that people can prepare and start looking forward to this fantastic event. My name is Edgar Valdmanis. I'm one of 15 global ambassadors for the Congress. And I have the pleasure of running this series of podcasts, interviewing various people that have been to the Congresses before, that share their views and experiences and everything with you out there. My trusted and loyal co-host is Eli Pollard from the head office. Hello, Eli. How are you?
I'm good, Edgar. So excited to be here today with our very special guests. I can't wait to get rolling.
Exactly. Our guests today are Jagdeep and Hani. Was that sort of halfway correct?
Yes, we need to test the pronunciation of everybody's names. Jagdeep, is that correct, our pronunciation?
That's cool. Fine.
And Hanny is technically Hannington, but everyone calls you Hanny as a nickname, right?
Yeah, so many call me honey. Yeah, sometimes, yes. So
All right, we're off to a good start. We got the names right, Edgar.
Yes. And then the next thing we can get right is what is your connection to Parkinson's and the upcoming Congress, etc. You are a fellow ambassador, Jagdeep, so you can maybe
sure.
start out with a
In,
little bit of background.
yeah, so I got diagnosed with Parkinson's back in 2021. I was fortunate enough to go to the Barcelona conference in 2023. And to be honest with you, that really opened my eyes to the wider community, both in research and different exercises people can do. And it's just been gone up, onwards and upwards from there, really. Yeah.
All right, Hani, how about you and your connection to Parkinson's?
Thank you so much, Edgar. My name is Hannington Kabugo. I'm from Uganda, East African part of Africa, and Uganda is the Pearl of Africa. My mom had Parkinson's. She died with Parkinson's close to 20 years ago. She was neglected, abandoned, and everyone ran away from her, even her own husband and her children. They had to leave her because everyone knew it's contagious. So the more we stayed together with her in the house, everyone is going to get Parkinson's. So my mom and my dad, they had a very good discussion together, and they agreed they separate ways to save us. So because of the love she had for us and dad, they agreed we should leave her alone in the house. And she remained alone until her time of death. I understand they told me she fell and she was found after some time. And that's how she died, with Parkinson's. So from that, I founded an organization, Parkinson's Isibuko, meaning Parkinson's is not witchcraft, to help dispel the myth in the country where people still think Parkinson's is witchcraft. So, and I'm happy, I'm blessed to be WPC Awardee 2023. I got the Elliott Award for my work I do in Uganda and Africa in general. So I'm happy to be part of this podcast. Thank you, Edgar.
Fantastic. How many congresses have you been to?
Myself, I've only attended one Congress.
And that was?
In Barcelona.
Right. And Jagdeep, you said something similar, didn't you? How many congresses have you been to?
Sorry, Edgar. Yeah, myself, I was only fortunate enough to go to the 2023 one, but bearing in mind that I was diagnosed in 2021, so yeah.
You both kicked off your WPC experience in Barcelona, and Hannington, you went big because you were nominated and selected to receive one of the WPC awards. And Robin Elliott, just so you know, he was very pleased with those people who were selected to win the award in honor of his name, and he and his work. He was one of the people who hired me at the beginning and helped to hire me to help launch the World Parkinson Congresses. He had a real visionary on bringing the community together. And so when he saw the list of awardees receiving the Robin Elliott Award, he was very pleased. So Hannington, have things gotten any better in Uganda with Parkinson's?
I need to be very honest with you. Of course, personal, I would say a little better because I'm the only Parkinson's disease advocate in the entire country, a country of over 50 million people. So I have to go in places. So I've changed a lot of people's lives that I accept. But I don't want to say things have gotten better because we still have the same problems. Awareness is still needed. Medication is still needed. We need to talk about Parkinson's in the country. We need to tell everyone about Parkinson's is Ciboco. That Parkinson's is not witchcraft. So I don't want to say things have gotten better, but I feel at least I've done a big job. At least now you can go to some places where people know it's Parkinson's. And when I move around my place, I've been with Jack. Jack came to visit to see what I'm doing in the country. And he saw how people call me the Parkinson's man. They stop me everywhere. Everywhere he has seen it, calling me the Parkinson's man, because I've challenged them. I've reunited families that were abandoned, people who ran away from their families. They can eat together, they can hug. So definitely things are changing. I need to accept that.
That's so good to hear.
You said medication is still needed. I think that sort of applies to all of us, but is medication available?
Yes, of course, availability, affordability is a problem because there are very few pharmacies that do not have Parkinson's medication. But I take it to the awareness because pharmacies are business oriented. So people, if no one is going to the pharmacy to ask about Parkinson's medication, then no pharmacy guy is going to get it in the pharmacy because no one is asking for it. So if we do more awareness, they are going to push. The patients will go to the pharmacies and ask for Parkinson's medication. Because at least I'm happy to report that the places have done the awareness in, there are pharmacies that have Cinemed, because patients that know now that they have Parkinson's can go to those pharmacies and ask for Parkinson's medication, putting pressure to pharmacies to get medication. So yes, few pharmacies have it.
Yeah, good. So things are moving in the right direction, albeit slowly.
That's good. I noticed for people who are listening to the podcast, you might not realize, but we're interviewing Hannington and Jagdeep. And Jagdeep lives in the UK and Hannington in Uganda. They're actually together right now. They're not separately being interviewed. They're literally sitting side by side in one computer screen. So Jagdeep, you're in Uganda. Why did you go to Uganda and what are you doing there?
Well, yeah, great question. So even though we went to the same Barcelona conference, I didn't actually get to speak to Hannington there, but then about 8 months down the road, I think Hannington saw some of my Instagram posts on boxing as such, and we got on with each other, and then we just broke the ice. I said, "Yeah, I actually saw you get the award, and you're amazing, and everything else." So the thing, yeah, so the talk was for me to do some Zoom call boxing over Zoom. So I said to him, "Look, I ain't a Zoom person really. I'm a more in-person trainer. So I'll do one better. I'll actually come over there and help us what I can do there." So yeah, so that's
So you flew to
how I'm
Uganda
here
to
now.
teach boxing.
Sorry?
You flew to Uganda to teach boxing.
Yeah, absolutely. Not just teach boxing, the thing to see, because sometimes you hear like Hannington tells everybody he's doing this, he's doing this. When you're physically there seeing it, and you're going to people's houses, and I've been to people's houses that people live with the chickens, and so they're sleeping in them the same room as there's like little chicks going around there, and Hannington just goes in straight. He doesn't worry about the room or what their health is like, because he goes in there and he tries to support everybody as best he can. So medication isn't possible for everybody here, because as we know, that's about 120,000 Ugandan shillings for one prescription, which works out to be about $35 a month. And but exercise, we know, can work. So that's where I come in, and that's where Hannington's picking up on as well, and he's showing them basic exercises that they can keep, and trying to change them the quality of life. Yeah.
Incredible.
Mm-hmm. It's
What you
incredible.
guys are. How many people live in Uganda,
We just had
roughly?
a census. We just
Big
had a
one?
census. We just had a census, which I
Right.
don't think it was so perfect, but they said we're 48 million people.
And then how many Parkinson's we estimate?
I don't know, because I've only covered not even a quarter of the country, because I'm the only person. It's me who has to go everywhere.
Yeah. No, it's just
If I can, Edgar, sorry, if I can just jump in there. So we've been to villages where Hannington goes to see like two or three possible cases of Parkinson's, but then so many others come out, and he just hasn't got physically the resources to go and see everybody. He just hasn't. Yeah.
no, I fully appreciate that. I was just poor on my math skills this afternoon. I should do a quick calculation in my head, but I would guess then that we're looking at 40,000 or so cases from.
Probably easy. Yeah,
Yeah.
easily.
I mean, we don't even get to see all our members. I'm a co-chair of the Norwegian Parkinson's Association here, and we estimate that we have about 15,000 people with Parkinson's in Norway, and there is no way we're even seeing all of those. So I can fully appreciate the job that you're doing, Annie, trying to reach out to such a large audience is amazing, I would say.
Yeah, with limited resources. I have one question, Hannington. In Uganda, do you have any Parkinson's doctors? Is there even one in the country? Or is it neurologists or general family physicians who diagnose people?
Well, this is what I did. Like I said, I'm the only Parkinson's advocate. First, we have a very few neurologists. I think in the entire country we could be having like 6. And out of the 6, only 2 are available. So what I did, first when I was doing the training, I'm a food scientist. So when I was doing the first training, I had to look for a neurologist who came and helped me that first time. And I told him, because it was expensive, told him I cannot afford bringing you in every time. Can we have, can we train other doctors, general practitioners, or any other doctors who are available? Then we can get such doctors on every time to prescribe and diagnose the patients.
Yeah.
And it was okay. So we have a group of doctors and nurses who can diagnose. And I also do, on top of that, I do the trainings to them. And what we also have what we call the village health workers. These are like the community health workers who live within our communities. They are not medical professionals, but they are medical volunteers who can come to our families and look at a person. They don't diagnose, but they identify. So I train them to identify people with signs and symptoms of Parkinson's, and they direct these people to go to those hospitals where I've had a training with doctors and nurses who can diagnose and prescribe to these patients. So that's what I do. And I've been doing it with Jag. Jag is lucky he has seen all those trainings with me.
Amazing. You're single-handedly building capacity in Uganda for this work, training one person at a time. The train the trainer model is a great way to build that community, and so amazing that you're doing it. That's why you were recognized and given the award at the Congress, because of your incredible work in Uganda. Tell us about your experience when you came to the WPC. Both of you, Jagdeep and Hannington. To start with Hannington, what did you expect? Was it what you expected? And how did it change you when you went back to Uganda? How did you go back different from when you arrived? Can you even put it in words?
First, when I'm talking about that, I even get goosebumps because it was an amazing when I received a call from you telling me that I was nominated. First, I didn't know people were seeing what I'm doing. I always tell people, do the good, people will see that good. You don't have to tell anyone. So I was so surprised. I couldn't hold my tears when I saw that. And then when I came to Barcelona, first, I was so impressed to see people I've been chatting with online for years, touching them, hugging them, talking to them. This was amazing. Learning from them. There's so many lessons we had at the WPC. That was incredible. And then after that, and then the D-Day, when I was told it's my day to receive my award. Oh, I surely thought I would run out of words, but I thank God that I made it. I had to have a little speech. I had a lot to tell people, but you cannot tell everyone because I was anxious and I'm like, oh, what am I going to tell everyone? Like a hall filled with people and everyone waiting for me. That has changed my life, And trust me, I do this work on behalf of all Africans, on behalf of all the Parkinson's patients, all the people related to Parkinson's in the world, because of the award I got. Because I was recognized, because I was appreciated. When we are appreciated, we gain more energy to do what we are doing. So I thank all the people who appreciated me, and I've never been the same. I do not sleep. Jack knows that I do not sleep because I think about these patients. What am I supposed to do? Sometimes I have to drive like 10 hours to meet a patient because I know in Uganda, if it's not me, then who? So I'm so happy and blessed to have this award.
Fantastic.
Yeah, I think I just wanted to add on to a hand, and I can actually testify that we've driven about 6 miles, and if you've been to Uganda, you know some of the roads ain't the best of roads, and driving for 6 hours when you've got traffic jams and the roads ain't perfect, it's not an easy feat to do. But coming back to the conference, to me, I never knew much about the conference at all. It was all like first time, and I was like, wow. I thought, wow, 3,000 plus people in the same community, and the different variations of the thing, the round tables, the scientific meetings, and everything else. It just blew me away. And I think it's probably the only conference of sort where it gets the patients co-involved, and you can sit around the table with some of the top consultants in the world, and you can actually ask them questions, and you can get feedback from others at the conference as well. It's absolutely amazing. Yeah.
Yeah, well, that's one of the things I've been talking to Eli about as well. As I say, it's such a large group of people, all are dedicated, all are knowledgeable one way or another, specializing in all kinds of fields. And they're, again, what I tend to bring up is that they are all available during the 3 to 4 days we're going to spend in Phoenix. Everyone is going to be there. No one leaves a day early or so because they want to be where the action is. And everyone contributes to the action. So, how have you kept up the networking with the people that you met in Barcelona? Have you sort of connected on Facebook or LinkedIn or to
Yes,
keep the
myself.
relationship going? I mean,
Yeah, myself, I've kept the connection with people I met in Barcelona, and then the live example is him.
Yeah.
So we had the connection from Barcelona. We didn't talk in Barcelona, but at least we met, and then boom, we are online chatting, and yes, Hannington we met, Jack we met, and then here he is. He's in Uganda. So it's through the WPC that he is in Uganda. And then the other time, you're going to find me in the UK because of him. So the WPC connection is still solid.
Nice. Nice.
Yeah, I couldn't have said that better. I think that's spot on. Yeah.
Yeah, because that is, of course, the challenge is to keep the networks going and the conversations and both speaking live like we are doing now, or sending each other a link saying, "Hey, here's another report from an interesting study they're doing currently in Japan or in Canada or even in Norway." Could be saying, we talked about this in Barcelona, here's another follow-up. I think that is very important. And I've kept 2 handfuls of my own good connections that I made in Barcelona and that I still keep up to date with.
So Hannington, one of the things we worked very hard on in Spain was the WPC worked hard to get a stronger representation from across the African continent. And it was perhaps a little bit easier in Spain because Spain is so close to Africa, and it was, geographically a little easier. But that's always been a challenge because it's sometimes hard to get visas from different African continents into Europe or into the US. So the next Congress is in the United States in 2026. And what we want to do is encourage our friends on the African continent to start applying for visas soon, because we're worried about visa application process. That's always a barrier of people getting into the Congress, wherever it is. After the last Congress in Spain, and you went back, and there was more connection across the African continent of people doing work. Maybe not in Uganda, but I know in Tanzania and Nigeria and Kenya, Ethiopia, South Africa, people are talking and connecting now, which is really exciting. Do you think that there's an interest from the people you're communicating with to try and make it to Phoenix? I say make it, of course, if there's no barriers, I'm sure everyone would come quickly and easily, but there's obviously financial challenges, there's visa challenges. what's the word? Are you hearing people talking about like how do we mobilize and get more African voices over to the Congress? Is that conversation happening?
Yes, we've had the same conversation in one of our meetings that we have as Africans impacted with Parkinson's. We've had these conversations. We always have problems with the U.S. embassies giving visas to us. So this is my advice would be if we are to do it, then people need to start getting invitations. Because when I'm to get a US visa, when you make an appointment, sometimes you're given 6 months or 8 because all the slots are full. All the slots are full. So this is the time to send that to let maybe other Africans might not know this who might want to go to Phoenix, but if they are to go, then they need to start working on this like now. Like now, they need to have visas. They need to start the visa appointments, and then see, because sometimes it could not be financed. Some people have their money to do it. Some people have their money to do it, but they need to start like now. The other problem that you need to focus on, I'm talking as an African this time. We have so many Africans that might want to use a chance to come to the US because there was a Congress, because there's a conference or there's a Congress. We've seen that. And then that also brings in the red flags to the very honest people, maybe like me, who wants to go to Phoenix because I have a purpose. You might find Hannington getting so many other people. I'm not saying I'm going to do that, but I know there are people who want to bring maybe a sister or brother or whoever, and they're not coming to the Congress. Maybe they will come, they pass through Phoenix, then after they go wherever they want to go, and they'll never come back. So you need to be very strict on that. Who is coming? Are they attached to Parkinson's? Otherwise, if we have so many people who are not attached and all want to come, then we are going to have problems like us who want to come honestly. Will all be denied visas because of the few people who are not honest. So the other thing would be I would request the WPC to find a way of how they can connect to the embassies. Sometimes the embassies, it's hard, but if you have the governors, the senators in those countries, in the US, people you can talk to as WPC. Sometimes you can give them a list, because embassies down here, they listen more when there is a letter from either a senator or from. So if we have those letters attached, and then we need to specify the names of people who are coming, that is very, very important. So if we have people who can stand in for us, like the senators and people say, no, these guys are coming purposely for this.
That's
and
helpful.
These are the names. It really helps a lot. It really helps a lot. If we don't do that, then so many Africans are going to be denied visas.
That's good to know.
Good. We're rolling towards the end here. I think actually finishing off with that strong talk here about starting the visa process now, not tomorrow, no, not next week, now, if possible. And then apparently, if they can get in touch with you, Hannington, then I think that would also be a good move for the people wanting to apply, since you have experience and very good advice on how to do things correctly and properly. And we would want to see lots of your countrymen and women show up in Phoenix, because it is important to see how Parkinson's is being treated in various parts of the world. Very educational for the rest of us. We usually finish off these talks on a lighter note. We have 2 exit questions that everyone has to answer. And the first one is, if you're being shipwrecked on a deserted island, and then you sit there and you see there is a traditional record player in the sand, and you think, oh, that would be nice, some music. If I could have only one record here, which would that be? For each of you, you have to answer it individually.
So you're stuck on a deserted island. What piece of music or musical album are you going to listen to until you're rescued? Could be years.
And can I go first? Can I ask why the question's been changed from the lift one?
Oh, you're going
this
to.
one?
Oh, the lift is coming up. The lift is coming up.
Oh, the lift is coming. Well, I'll probably say it will be Nat King Cole.
And the song would be, or the album?
I don't know if you know about any of his songs are good for me. Any of his songs, yeah.
Nice.
Okay,
I like
Hannington.
that.
Okay. For me, I wouldn't mind any country music. Any country music.
Like
Wow.
in the US?
Yes. Any country music.
That was
If you were to be a bit more specific.
Excellent. Very good. All right. Next question.
Okay, and then the lift question, which you're obviously familiar with. If you're stuck in an elevator between two floors, who do you want to be stuck with?
Not forever.
So
just
you go first, then.
for a period of time. Anyone, alive or dead?
To be honest,
Yeah.
I think I would be stuck. I have a lady called Miriam. She had Parkinson's, and she was locked in her house for 7 years. She was in her bedroom for 7 years. She never got out for 7 years until I went there because someone told me she was a witch. So I went to this witch's house. I told them my mom was a witch. So I need to go and see the sister of my mom. So because my mom is dead, I found Miriam. I got her, brought her in my house for 2 years. I took care of her until her family saw that, oh, this is not witchcraft. This lady has been with some family. They eat together, they hang out together. Regardless of her being paralyzed, she can't walk, she can't sit, but at least she's happy. She has a wonderful smile. So if I ever get stuck in an elevator, I would want to be locked with Miriam because I'm her savior every day.
Fantastic. And Jagdeep?
Mine's quite quick. I'm a religious person, so I would say any of my 11 gurus. So we've got 11 gurus, so any one of them would have been fine with me, yeah.
Okay.
Love it. I love everybody's answers. Everybody's so different. I love it.
Yeah. This is fantastic. Thank you both for being with us today. Thank you, Eli, once again for co-piloting another episode of the Here podcast. For those of you listening in, do revisit our page for the earlier episodes that have already been published. And we're looking forward to seeing all of you in Phoenix, Arizona, May 2026.
Thanks so much, everybody.
Thank you so much. See you all in Phoenix. Love you.
Bye. Bye, everyone.
Bye-bye.
Bye.
Thank you for joining the Here Parkinson's podcast. If you would like to experience the next World Parkinson Congress for yourself, to feel and see the change in real time, save the date to join us from May 24th to the 27th, 2026 in Phoenix, Arizona. Learn more at WPC2026.org. This podcast series is made possible with support from Blue Rock Therapeutics.